You're watching the Isaiah Factor Uncensored.
Welcome and thank you for joining us for the second half hour, The Factor Uncensored. It wasn't just a traffic nightmare. A woman also appeared to be crying out for help. You likely heard about this situation in Houston today. Many people were laughing about it. A woman sat on I-45 for hours, armed and apparently in distress. Tonight, we're looking beyond the headlines and asking a therapist what this moment reveals about mental health and crisis response.
So, Dr. Boone, when you have a situation like this, someone clearly in distress and sitting in the middle of a freeway on a chair, and I'm not sure if she's armed or not. We're hearing rumors that she may be, but clearly something is going on with this woman. Your thoughts about that?
Ideally, you want to have someone who either is family that she trusts and she's already built a rapport with, or a professional that knows how to approach this woman in a way that's not alarming, because we don't know her state of mind. We don't know if there's any diagnosis or what that diagnosis is. So you want to be able to relate or feel like have her feel comfortable with you, so you can try to kind of get her to the side of the highway, to the shoulder of the highway if possible.
Now, when we have someone like this going through this, how important is it to make sure that loved one, that family member, doesn't get to this point where they're putting their lives in danger and other people's lives in danger?
It's so difficult because, ideally you want to be able to prevent this by helping them ahead of time before it gets to this point. But you don't know if, a lot of times people with more acute disorders don't want to take their medication. And as the family member that's helping, you don't want to put yourself in danger. So you definitely want to call an officer, someone that can hopefully try to direct traffic a little bit so that you can have access to your loved one. But it's a really difficult situation. And, it's not something that you see every day, obviously. So you have to just kind of do your best with what you got.
And when you have a family member that's going through mental health problems and maybe the family's in denial, I don't know, but that family is not taking it seriously and it could escalate to something like this. What should you do if you're not quite sure, armed with the knowledge to deal with someone with mental health issues?
I would call for like an emergency psychological evaluation. You can go to centers like MHMRA, well, formerly known as MHMRA, now the Harris Center, to try to get them some help, because it's not always that they don't take them seriously. It's just that they don't have the knowledge and they don't know what to do with it. These people are mentally ill, but they're still able-bodied. So if they want to just walk away and not listen to you, they can just walk away and not listen to you. So a lot of times the family's hands are tied and they have to kind of throw their hands up because they don't know what else to do. And that's why I would suggest or recommend that you do call in a professional. You do go to these agencies that know how to deal with a lot of these acute disorders in a way that is most effective. So that's what I would recommend.
Now, we've seen on television and dramas and what have you on television, and they're like, well, I need to get this family member the help they need, so I'm going to have them committed. Is that easy as it appears on television, or is it much more difficult, and does the courts have to get involved, and is it a lengthy process?
It doesn't have to be difficult. It's difficult in that, the loved one with the disorder may not want to go. But as far as getting them admitted, that can happen actually pretty quickly if they show up to the mental hospital or the mental institution, because they're so used to these calls. And so they can look for the signs. They can do a quick evaluation and have them admitted that day. So it doesn't have to be, as far as time, a long thing, but it can be difficult, actually getting that loved one to the establishment.
And when we talk about having them admitted, is there a time frame that they'll keep them to make sure they don't harm themselves, or is that totally up to the family, up to the patient? Up to whom?
Yes. So depending on the evaluation, once they are evaluated and the hospital, or if they're brought in by the officers, they are going to be watched. They're going to be under watch for at least 24 hours to 72 hours, depending on, the severity of the case. So that once it gets to that level, it's out of the patient's hands. This is now, we're doing what is safe for you. We are going to have you under evaluation and under watch for that period of time.